This is part 2 of the chapter 4 discussion, kind of finishing up after we talked a little bit about antagonists and agonists, etc. Just to wrap up a couple of more concepts then. Still in chapter 4 then, sorry. One of the things we talked about a little bit, and you saw in the earlier clip of the video, was therapeutic index. And just to review that very quickly, we know that the therapeutic index is the measure of the drug's safety, and it's the ratio that we know that there's a difference between the amount of drug that is needed to produce the effect desired and then the amount of drug needed to produce toxicity. So that window between the two is its therapeutic index. The larger the index, the safer the drug. So again, we talked about those drugs that have narrow therapeutic index are much more worrisome and often need closer monitoring. The next thing was the drug interactions. The book spoke of this in a lot of detail. Essentially what what we need to remember is that drugs can potentiate each other. So sometimes when you have drug-to-drug interactions, it can be a good thing. It can potentially intensify the effects of the drugs. One drug may reduce the effects of the other drug, or the combination may produce a new response not seen with either drug alone. And as we've come a long way in technology and pharmacology these days, we do this a lot with different medications. The example your book gives was the interaction between sulbactam and ampicillin, because it represents a beneficial potentiative interaction. When you administer it alone, ampicillin undergoes rapid inactivation by bacterial enzymes, but when you add the sulbactam, that inhibits those enzymes and prolongs and intensifies ampicillin's therapeutic effects. We know the other example, which we've heard about, I'm sure, in your nursing career, was the interaction between aspirin and warfarin. That could be dangerous, right? Then we know that some drugs can reduce the effects of other drugs as well. We know that sometimes these drug-to-drug interactions can cause different side effects or issues. We also know that drug interactions could be changed by drug absorption. The examples they give here is that like laxatives can reduce absorption of other oral drugs by accelerating their passage through the intestine. You can have altered distribution, competition for protein binding, altered metabolism. That's all there in your reading as well. We know that those CYP, cytochrome P450, and those different enzymes can interact with each other and alter metabolism. I would not get caught up in trying to memorize anything in terms of details of which drugs in particularly. This is more the idea that we have to be cognizant of drug-to-drug interactions. The last thing that I wanted to point out in your reading here to end with the chapter 4 is the grapefruit juice effect. This is something that a lot of medications have, or it's not uncommon, I would say, for people to be counseled about grapefruit, and it's really a true thing. And it is different between grapefruit and something like orange juice. They are different things. Grapefruit has different compounds inside. Two flavonoids in particular that it talks about here that other citrus fruits do not have. The drug interaction of all the fruits hasn't been tested, but we know that grapefruit juice is well known. It raises drug levels by inhibiting the CYP3A4 metabolism. And again, I'm not going to ask you specific questions about which CYP interaction is affected. We're talking more about the concept of understanding that the ingestion of grapefruit does actually cause some interaction with medications, oftentimes not a good thing. Refer to table 4.3 in your reading. And there's some drugs whose levels can be increased by drinking grapefruit juice, and that wouldn't probably be a bad thing. And these are fairly common drugs. The dihydropyridines, the calcium channel blockers, statins, amiodarone, carbamazepine, Buspar, midazolam, cyclosporin, some of the anti-rejection drugs like tacrolimus, some of the SSRIs. So truly, grapefruit juice is something to understand, that it is not something to belittle. It is something that you should counsel your patients on if it's a true issue. And with that idea is that there are some food interactions that can increase toxicity. We'll talk about it briefly in that section, but the MAOI inhibitors that could be taken for depression, they have the most dramatic example of the interaction between foods rich in tyramine, like cheese, yeast, examples of that. If people were to be on an MAOI inhibitor and not follow a strict diet, they will have poor drug-food interactions. And then again, part of what you'll learn in practice too is that we always want to know again what all the home medications that our patients are taking, including over-the-counter supplements, because dietary supplements or herbal medicines and those things can create potential for frequent interactions with our more traditional or conventional drugs from manufactured drugs. And that's the end then of chapter 4, and we'll catch you then in chapter 5. Thank you.